Welcome back to Overnight America. Hey, have you ever had medical symptoms and Googled your symptoms to see what you might have? Of course you have. We've all done that. But that begs the question, is that really an effective way to see if you have a serious medical condition? Or is it just a way to give you anxiety thinking that you've got some, weird disease that's only found in the Amazonian jungles? So to get to the bottom of this conundrum, I reached out to noted cardiologist Dr. Fahmi Farah, who is a highly trained and accomplished cardiologist. She practices cardiology in Fort Worth, Texas. She's the founder and CEO and medical director of Bentley Heart Medical Group and is an adjunct assistant professor of medicine at the University of Oklahoma Health Science Center. Dr. Farah, welcome to KMOX.
Hi there. Thank you for having me.
Hey, I know you were even treating a patient here within the last hour, so thanks for making time for us this evening.
Hey, no problem. Thanks for understanding. Yes, one of my patients had an emergency week, so
not a problem.
Thank you
Not a problem.
for accommodating that.
It's our pleasure. So people who Google their symptoms, in your experience, is this a common thing that people do?
Very common, actually, and nowadays even more so with, all the smartphones. It's just Google is available. So, yes, I would have to say more or less almost every single one of my patients tell me that they Google their symptoms.
Well, the conventional wisdom, as I've read about this over the years, the conventional wisdom had always been that if a layperson Googles their symptoms, they're assured of only two things: a misdiagnosis and self-inflicted anxiety, thinking that they have some weird disease like chronic focal encephalitis or something. So, I don't know if that's even a disease. I made that up. But the Journal of American Medical Association just published a study indicating that good old Dr. Google may be more accurate than we previously were led to believe. What were the results of that study?
Yeah, that study did show exactly what you said. It came about because everybody's noticing that more and more people are going on Google. And so I think this was a helpful study to basically try to see different disease processes. It's basically a small group study, a group of patients they studied, and they tried to see how accurate they were in their diagnosis. And so, I honestly have mixed feelings about this study. For one, whether this is going to make changes, whether it should change anybody's guidelines, absolutely not. And this study, anytime we look at a study, one of the things we have to look at is the power of the study, how powerful is the study. And that, of course, it has to involve many, many patients. It has to involve multi-center. It has to involve, a lot of different things. And in cardiology, for instance, the studies that really make an impact are what's called prospective, double-blinded studies. And this was certainly not one of those types of studies. That's not to downgrade what the results they've found. It's interesting. It certainly is interesting because this is something we're dealing with on a daily basis, almost on every patient. They're Googling themselves. Personally, me as a professional and as a cardiologist, my take on it is that Googling, we all do that. There's nothing wrong with Googling. In fact, if somebody's having symptoms, it's always okay to Google and get a broad picture of what it could be. But I agree with you, what you said at the beginning, that anxiety part, it does cause anxiety. I actually get a lot of patients who come to see me simply from the anxiety from Googling something that they saw. And it's, when you Google something, it just gives you like 100 different things that it could be, and some of it could be accurate, some of it could be really inaccurate. So the source really matters. So I wouldn't say necessarily that everything that you find on Google when you type in a symptom is accurate, and I wouldn't say that everything is inaccurate. The bottom line is that if you're having symptoms, you need to see a medical professional, you need to see a doctor, and let the professional guide you in your symptoms. That's my take.
Absolutely. And we're talking to noted cardiologist Dr. Fahmi Farah in Fort Worth, Texas. So from your perspective as a practitioner, when you see your patients, undoubtedly they have Googled some of their symptoms. Do you find it to be, in your own personal experience, a benefit that they're better educated, or do you find it detrimental that they may have latched on to some disease or condition that they, from your perspective, obviously don't have?
I've actually experienced both sides of the spectrum with this. There are some patients who will go to Google and they'll read up on some of their symptoms, and when they come and I explain to them and we do some diagnostic testing, they sometimes have a better understanding. They seem to grasp it better. But on the other side, I do get patients who will Google something and they'll get inaccurate information, and then they will come, and when you tell them your medical expertise and opinion, they will be at a conflict because they read something on their own and what you're telling them is clearly different. Mm-hmm. And those are the patients who I find that they put themselves at a disadvantage for their own health, because they sometimes want to go along with what they read on the internet as opposed to what a medical professional is guiding them or advising them to do. So those patients, it does become very difficult to deal with that kind of a situation, because it kind of, in a way, takes away that trust from the medical professional. It's not everybody. It's very rare. Very few patients will have that kind of an experience with, at a medical office. But for those patients, it does make it very difficult because they're often led in a wrong direction, so to speak.
Sure, I can see that. Now, I'm an attorney by day, and I Google medical terms and conditions literally every day as I read and analyze medical records. And as I'm preparing to depose doctors, I read online all the time. So I've kind of learned what amounts to a good source for medical information online and how to spot questionable sources. And you mentioned a few moments ago the importance of finding good sources. So, Dr. Farah, what advice would you give to lay people just on how to distinguish between a credible source and a questionable source when it comes to medical information online?
Yes. So some of the credible sources would be, American Heart Association, for heart, heart.org. And then some of the other institutions, the really well-known institutions, have a lot of medical information for the general public, such as the Cleveland Clinic, Mayo Clinic, Harvard. Mm-hmm. All of them actually have on their website a public education page. And also on social media, they all have social media like Twitter and Instagram with good information for the public. I think those would be more trustworthy. What I wouldn't do is just Google something and not look at the source, because anybody can write anything online,
sure. And people do.
Yes, and I get that often, actually, where people will just read something online. They don't even know what the source is. It's completely wrong information a lot of times. And they'll come, and when you're telling them otherwise, they're at a conflict because they don't know who to trust. The advice is always to trust your medical professional who's, gone through the training and, of course, at a much better place to guide you and advise you, as opposed to internet. On the other side, even when you are going to credible sources like the ones I mentioned, even then, it's always better to use that as an educational source, but not try to treat yourself. If you're having symptoms, the biggest message I can give to the listeners is that you should seek a medical professional's advice.
So after folks then are Googling online, they're following your advice, they're looking at noted educational health websites, or looking at known facilities like the Mayo Clinic or Harvard or the Journal of American Medical Association, those types of sites. After they get that information, your advice then is to use that for educational purposes and then go talk to the physician that you know and trust to see exactly what you should do at that point. Is that what I'm hearing?
That's exactly right. Yes.
Very good. We're talking to noted cardiologist Dr. Fahmi Farah in Fort Worth, Texas, and one of my favorite authors is Dr. Robin Cook, and he writes medical thrillers, and they're always very exciting, and they're very medically detailed oriented. But he wrote a book a few years ago about a cell phone app that was designed to diagnose and to treat diseases. And of course, it's a thriller, so things went haywire. But I guess my question from your perspective is, do you foresee a day where it could be a reality that we could use an app or a website to accurately diagnose and even treat conditions? Do you see that day coming sometime soon?
I sure hope it does. If technology can provide that, that would be wonderful. But I think that would be difficult to just diagnose and treat based on something the internet will tell you. Just because, disease processes can be so complicated, and it really does require, it's not a cookie cutter thing. It's not a recipe book medicine, So, there's a lot of repetition, sure. But it really does require individual attention. There's so many things that you need to consider, not just the symptoms, but the risk factors. Like, when it comes to diagnostics, like there's so many things you can choose from. What is the best one for that individual? It can differ from person to person. What is the best treatment? There's like 10 different treatments for the same disease. How do you choose the best one for that individual? And that's when the expert opinion really matters. So to answer your question, I don't know if that's ever going to be possible where we can just Google or get on the internet, diagnose ourselves and treat ourselves. I think that would be very difficult.
Yeah, because something as benign as whether a patient is taking supplements or vitamins or over-the-counter medication, that could drastically impact the choices of treatment options for a patient. And there's no way that Dr. Google would know all of the supplements or OTC medications that a patient might be taking.
Exactly. That's an excellent point you made. Dr. Google is not going to know exactly what your risk factors are. They're not going to know what are all the medications you're on, the interaction, none of it. And then on that same point, similarly, say you Google headache. That headache could be migraine, something as simple as that, or a tension headache. But the spectrum is so wide. Headache could also be because you're having a stroke, or it could also be because you have a tumor in there, So that's what I mean. It's just the spectrum is so wide and broad, and the disease process in the human body is so complex. To go through medical school, just to give you an idea what it takes for someone like me, a cardiologist, it takes 14 years of training before I can give my expert advice as a cardiologist. There's a reason behind it, because it really takes that much dedication and time to learn the complex process, that the disease processes that's involved. So to say that we can simplify all of that and just Google something and treat ourselves, I don't think that's safe.
We're talking to noted cardiologist Dr. Fahmi Farah, and if folks want more information on you, your cardiology practice, and how you treat patients, how can they find information about your medical practice?
They can go to my website. It's bentleyheart.com. They can also find me on social media. My Twitter handle is Fahmi J. Farah. Same thing with Instagram handle.
Fantastic. Dr. Fahmi Farah, thanks so much. I know you had a busy evening treating patients, and thanks for making time for us here on KMOX.
Thank you so much. I appreciate you.
Hey, and that was great. I'm glad she had time to fit us in between seeing actual patients. I think she left a patient's side and then came to call in to talk to us this evening. So I really appreciate her making time for us. Hey, this is Overnight America. We'll be back right after this.